Hello, my name is Melissa Daniels, and this is Strabismus to Stereopsis. On this channel, we talk all about strabismus, and today we're going to go into a little bit more detail about strabismus surgery and how to find a great strabismus surgeon. This can be a little bit tricky, so there's no foolproof method that's going to give you a guaranteed success, but I'm going to give you the tips that I do know about. Before I jump into that, I want to make sure you know you can go over to learn.strabismussolutions.com. Over there, I've got a lot of different resources that can help anybody with strabismus. Starting with the quiz, where it takes you through this guided quiz, helping you understand what some great next steps would be for you in your specific circumstance. So whether that's esotropia or double vision or brain injury, there's a lot of different reasons why you might be struggling with strabismus. So the quiz is going to kind of guide you towards answers and solutions that will be helpful for you. So highly recommend that. I'll put the link in the description below. How do we find a great strabismus surgeon? This is a little bit tricky. It's something that I have worked pretty hard on, and what I found is that sometimes a terrible surgeon can get great results, and sometimes an amazing surgeon can get bad results. Strabismus is not 100% success for any person, no matter how brilliant they are. And so, as I'm telling you these things, this is not going to guarantee a success in your surgery. And so being open to that, but I do think that finding someone with experience, especially if you've had multiple surgeries, is going to help just because they have more experience. And sometimes, especially as adults with strabismus, there's a lot of nuances that are going to change things. So the first thing is you want to make sure you're going with a pediatric ophthalmologist. So if you go to aapos.org, that is the organization of pediatric ophthalmologists, and you can search by location and it'll give you a list of pediatric ophthalmologists. That's a great place to start because the surgery is performed by an ophthalmologist, but there are so many different subspecialties of ophthalmology. And so you want to make sure you're going with someone who specializes in strabismus. And those are generally called pediatric ophthalmologists. Even though we're not children, that's still who is going to work with an adult with strabismus. Now, when I start going to the website of maybe a clinic that has multiple surgeons, I start looking, the next thing I'm looking for is specialties. So if I've got a surgeon who says, I do strabismus surgery and cataract surgery and retinal detachment surgery, I don't even know if that's a surgery. No, it is a surgery. Trying to think, there's a lot of different subspecialties. And if they say they can do all of it, I'm the best, I can do everything, I immediately put that one aside. I'm always looking for somebody who specializes in strabismus surgery and amblyopia. Sometimes you'll find surgeons like that also do cataracts, and that's going to be for people that is involved with strabismus, but still I'm always looking for somebody with small numbers of specialties. So that's kind of the next thing I'm looking at once I I've got a pediatric ophthalmologist, now what's their subspecialty? The next thing that I look for is on the website, and that is their research. There are a lot of different focuses even for a pediatric ophthalmologist. So I just kind of look. Sometimes there might be 5 strabismus surgeons in the same office, and I look at each one and all of their research. And there might be one that's researched adjustable suture techniques in adults with strabismus. And I'm like, ding, 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 I like that one. Or babies, they're really focused on babies with cataracts and strabismus treatment for them. And it's okay, that's an amazing profession, but that's not what I'm dealing with. So you can kind of see where their interest lies and where they've really put in that extra time and work. So again, it's not a guarantee, and a lot of times it doesn't give you a lot of information, but every now and then I'll find one that I'm oh, they've done so much research on amblyopia and strabismus surgery and how they work together. That's the guy I want, or the girl I want. So that's the next thing I look for. Another thing that I consider is when I call the office to schedule an appointment, and if that office says, oh yeah, we can get you in later this week, that's a red flag. Pediatric ophthalmology is a pretty specific specialty, and the good ones usually have a wait of at least 1 to 2 months. For my strabismus surgeon, I had to wait 3 months to get into the office and then another month or 2 to get in for surgery. And I know sometimes you're I just want the result right now. But waiting for those people that are more specialized is going to make a difference. So I always am looking for a long wait time That to me says, oh, this person is worth waiting for, because there's so many people that are willing to wait for this surgeon to do their surgery. Another thing that I look into after I've maybe gathered my top 3 or 4 favorite strabismus surgeons in the area, I then start asking around, whether it's friends, neighbors, doctors, my vision therapy, a vision therapy office, another ophthalmologist, like those people, even a pediatrician. Pediatricians are often referring to ophthalmology for their patients, and they're always going to the pediatric ophthalmologist. So they are going to have recommendations, and they get a lot of feedback about what's going on with their patients. And so they're a little bit more directly involved and able to see those successes and how the surgeon operates, that kind of thing. So I'm definitely always checking with other professionals, friends. Sometimes yields nothing. Sometimes you get a lot of really great information. I want to send a little caution and just kind of make you open and aware. A lot of times people go straight to Google reviews and they look at the Google reviews and that's how they decide who they're going to use. But I would read those reviews and see what information they give. I have found that sometimes an office will have a really low star rating, but then you go read it and it's like, oh, the office wait times are horrible. And, I didn't like how far it was and the parking was really bad. I'm like, okay, like that's a pain, but you're not going in for visits all the time. And if that's what it takes to get a really good surgeon, like, are you willing to have long office wait times? Maybe. That means usually that the surgeon is spending a lot of time with each individual patient, and that's why they're so behind. That could be part of it. So just kind of be aware. Now, if you go and read and they have horrible reviews and it's like, I have strabismus, it made it so much worse, he messed it up so bad I had to go to a specialist across the country. Okay, take that into consideration. So just read the reviews and decide, does this have to do with their ability to do a strabismus surgery, or is this just their personality? Do they have sometimes the really good ones are kind of pompous and annoying. Just like full of themselves, bad bedside manner. That's kind of common for the really, really good surgeons. And so you have to decide, like, is that a trade-off you're willing to accept? Some people, it's like, no, I need that bedside manner. That's so important to me. And some people are like, I don't care. I can deal with a bad personality as long as they're good at operation. So just kind of be thinking about that. Those are some things to think about. I've talked a lot about adjustable sutures on this channel. And while I do think they make a difference, the research shows that it only is a difference of like maybe 5 to 10%. So it's not this huge difference that it makes. But especially if you have double vision, I would make sure you find a surgeon that is able to do adjustable sutures, because especially when you have double vision, that's when that fine adjustment at the end, when you can give feedback, is so beneficial. So I will say adjustable sutures, especially for double vision, can make a huge difference. Or if you're able to use both eyes, if you have that awareness. Now, if you're only using one eye, the adjustable sutures are still good, but not necessarily going to make as much of a difference. There are a lot of different techniques for surgery. Some prefer to operate on as many muscles as possible to spread out the pain across all the eye, and some want to do it all on one so that you don't have so much recovery. There's a lot of different theories and techniques used in surgery. And what my surgeon told me was that it doesn't make that big of a difference. When you look at the research and the studies, someone who uses adjustable sutures who doesn't, or versus who doesn't, or somebody who is more likely to only operate on one eye versus both eyes, those things are more personal preference and not necessarily going to be a huge impact on the overall result. But it can make a difference, and I think that difference isn't huge. So if the strabismus surgery is normally a 70% success rate, it might get you up to like a 75% or an 80% success rate. It's not going to be this huge difference, but it's enough of a difference that it's worth that effort, especially if you've had multiple strabismus surgeries in the past. Like I said before, there is no guarantee on results for strabismus surgery. You could get the best surgeon, Dr. Guyton from Boston Children's College. I think he's considered one of the better surgeons in the United States. And I think he has a very long wait list. And you could get on his wait list and you could go to him at this like amazing strabismus surgery center with so many brilliant minds. And you could still be part of the 20 to 30% of people whose strabismus surgery is not successful. That is completely possible. And going through all these things and trying to find someone good, yes, that increases that percentage of success. Not by a ton, but some. And that makes a difference, but it doesn't guarantee anything. And so I think that's a good thing to know going into surgery. Like, do your due diligence, find the best surgeon you can, go there, but then also realize like this isn't a guarantee. And of course, I'm always talking about vision therapy. What are things that you can do to help even improve that success rate even more? And to me, that's making sure your brain knows how to use both of your eyes together. If your brain knows how to use both of your eyes together, then once they're straight, your brain is going to be like, I like that. If your brain can't use your eyes together, then and your eyes become straight, your brain's going to be like, oh, I don't like that. Let's put it right back where it was. And so that's another thing that you can do to increase those success rates. And so by you doing all these things, doing some research on the surgeon, doing vision therapy, teaching your brain how to use both eyes together, all of those things are going to help you have a better success rate when it comes to having that surgery. So those are your tips. If you have more ideas or a favorite surgeon, definitely share it in the comments. I had surgery with Dr. David Peterson in Salt Lake City, Utah. He is phenomenal, does a great job, uses adjustable sutures, tons of experience, huge wait list. He checks all the boxes. And if you're in the area, I definitely recommend him. But there are other surgeons just as amazing, just like him, all over the country. So if you know one, put it below in the comments. And if you want help finding one in your area, you can always schedule a consultation with me over Zoom. I'll do research beforehand and look in your area and try to help you find and narrow down who the best surgeon in your area is going to be for you. So that's always possible. You can do that over at learn.strabismussolutions.com. And I hope you all have a wonderful day.